हेलो स्टूडेंट्स, तो आज हम लोग बात करेंगे अबाउट ऑल द आर्टरीज इन वन शॉट। सुपेक्स की आर्टरीज के बारे में बात करेंगे। सो फर्स्ट इज़ एक्सिलरी आर्टरी। मैं सब आर्टरीज का ड्राइंग करके आई हूँ। सो आई वुड जस्ट टेल अबाउट द पॉइंटर्स दैट यू नीड टू राइट इन योर एग्ज़ाम में जब भी कोई आर्टरी का कोर्स जनरली ऐसा डिटेल्स में उतना नहीं पूछता है, बट कुछ कुछ इंपॉर्टेंट आर्टरीज है दैट इज़ प्रेजेंट इन अ बॉडी, जो जिसके कोर्स के ऊपर, रिलेशंस के ऊपर, ब्रांचेस के ऊपर क्वेश्चंस आते हैं, ठीक है। एंड वेन एवर यू हैव टू राइट अ शॉर्ट नोट अबाउट दैट आर्टरी, तो उसका डायग्राम ड्रॉ करना है। यू हैव टू राइट अबाउट इट्स कोर्स, रिलेशंस, ब्रांचेस, ठीक है। कोर्स में ऑरिजिन और टर्मिनेशन भी मेंशन करना है, ठीक है। So first is the axillary artery. Let's talk about its course. In the course, it begins from the outer border of the first rib. Outer border of the first rib, they say it is a continuation of some kind of artery. So it is a continuation of the third part of the subclavian artery. Okay, so after the outer border of the first rib, it moves mostly in the axilla. It is confined in the axilla itself. Okay, so it is passes from apex to base of axilla along the lateral wall. मतलब it is present along the lateral wall of the axilla, ठीक है। So when it is moving around the lateral wall, is it exactly present in the midpoint between the anterior and the posterior wall? No, it is present closer to the anterior wall compared to the posterior wall, ठीक है। After that, the pectoralis minor muscle यहाँ पे दिख रहा है. So it is overlapped by the pectoralis minor muscle, and this pectoralis minor muscle divides it into three parts: one present proximal, one present behind, and one present distal to the part of the muscle. So pectoralis minor divides it into three parts. फिर you can write the three parts: one present proximal, one present posterior, one present distal. Next is the termination. The termination, we can see we have a muscle called as the teres major muscle, and it terminates at the teres major muscle, and after that it will continue as the brachial artery. ठीक है, so it terminates at the lower border of teres major. ठीक है, हो गया. So if we talk about the branches that are present, next let's talk about the branches. There are three parts. I said the first part has only one branch. ठीक है, this is the branch, that is the superior thoracic artery. Superior thoracic artery. You can write it down here. I'm not writing the branches, like I'm just saying it and labeling it. You have to write it in your exam, the branches of the first part, of the second part, and of the third part. In the first part there would be only one branch, in the second part there will be two branches, in the third part there are three branches. So let's talk. In the first part we have the superior thoracic artery that is present. In the second part we have the thoracoacromial artery, and this thoracoacromial artery further has four branches. One is the deltoid, pectoral, acromial, and clavicular. ठीक है, this is the artery of the second part, and the artery of the second part there are two arteries. One is the thoracoacromial artery, another is the lateral thoracic artery. तो कभी कभी कन्फ्यूजन हो सकता है दैट सुपीरियर थोरैसिक आर्टरी और लेटरल थोरैसिक आर्टरी दोनों में से कौन सा किस पोर्शन का पार्ट है. तो ऑलवेज रिमेंबर द फर्स्ट पार्ट सुपीरियरली प्रेजेंट होगा तो मेक इट सुपीरियर थोरैसिक आर्टरी, और सेकेंड पार्ट थोड़ा सा बिलो प्रेजेंट होगा तो इट विल बी लेटरल थोरैसिक आर्टरी. नेक्स्ट थर्ड पार्ट का तीन ब्रांचेस है. वन इज़ द पोस्टीरियर सर्कमफ्लेक्स, humeral branch, posterior circumflex humeral branch, another is the anterior circumflex humeral branch. Okay, so we have this humerus that is present. So this artery that is present, it actually circumflex the neck of the humerus. So that is why we actually called it as posterior and anterior circumflex humeral branch, as it is circumflexing the neck of the humerus. ठीक है, तो इसको रिमेंबर करना. द थर्ड ब्रांच दैट इज प्रेजेंट इज नथिंग बट द subscapular artery, which is actually the largest branch also among them. So इसका एक branch, it gives a branch that is the circumflex. It gives a branch that is the circumflex scapular artery. So after giving the branch, तो the remaining artery का नाम change हो जाता है, and it is called as the thoracodorsal artery. ठीक है, remember that. So we are done with the branches. Next, move on with the relations. Yes, we are done and dusted with the branches. Next, हम लोग अगर relations के बारे में बात करेंगे, let's write it down here. Relations. Let's first mark it in the diagram, then we will write it down. So relations में if you see, let's first of all, कभी भी अगर whenever you are drawing a diagram in anatomy, तो always mention the directions. मतलब कहाँ पे कौन सा direction में, कौन सा anterior portion है, कौन सा posterior portion है, always you have to mention it. ठीक है, so here हम लोग लिखेंगे anterior, posterior, medial and then lateral. ठीक है, अभी always remember that sub portion में medially we will be able to see axillary artery, axillary vein. axillary vein सब जगह पर दिखेगा. ठीक है, AV लिख देती हूँ. ठीक है, so whenever you want to make out the relation present anteriorly and posteriorly, always सोचो कि कोर्स कहाँ से जा रहा है. ठीक है, एंड जब भी कोर्स तुम सोचोगे, इन द फर्स्ट पार्ट posteriorly प्रेजेंट होगा सेरेटस एंटीरियर. सेकेंड तुम सोचोगे देयर विल बी सबस्कैपुलरीज, और टर्मिनेशन के पोर्शन में टेरिस मेजर प्रेजेंट था. सो देन द सेकेंड पार्ट posteriorly विल बी subscapularis, और जो थर्ड पोर्शन में प्रेजेंट होगा, मतलब दिस इज द फर्स्ट पोर्शन, फर्स्ट पार्ट ऑफ द आर्टरी का रिलेशन, सेकेंड पार्ट ऑफ द आर्टरी का रिलेशन, दिस इज द थर्ड पोर्शन ऑफ द आर्टरी का रिलेशंस. सो दो चीज़ प्रेजेंट होगा, वन इज द सबस्कैपुलरीज, अनदर इज द टेरिस मेजर. ठीक है, नेक्स्ट एंटीरियरली सोचो क्या होता है. जनरली हम लोग के चेस्ट में पोर्शन में पेक्टोरलिस मेजर प्रेजेंट होता है, ऑन एंड जो सेकंड पोर्शन ऑफ द आर्टरी है दैट इज प्रेजेंट बिहाइंड द पेक्टोरलिस माइनर. सो एंटीरियर रिलेशन में पेक्टोरलिस माइनर भी रहेगा. सो इन द फर्स्ट पार्ट एंटीरियरली वी हैव द पेक्टोरलिस मेजर. In the second part, we have both the pectoralis major as well as the pectoralis minor. In the third part, we have a bit different, that is the median root of the median nerve. It is a bit different. ठीक है. Second, next चीज़ के बारे में सोचो about the roots, the cords of the brachial plexus. ठीक है, सेकेंड पार्ट इज़ वेरी इजी, लाइक मीडियल कॉर्ड मीडियल होगा, the posterior cord will be present posteriorly and the lateral cord will be present laterally. And if you push these cords in the clockwise direction, you will come to the first portion, फर्स्ट पार्ट का रिलेशन पता चल जाएगा कि मीडियल कॉर्ड को अगर क्लॉकवाइज मूव करेंगे इट विल कम इन द पोस्टीरियर, सो मीडियल कॉर्ड इज प्रेजेंट पोस्टीरियर, एंड पोस्टीरियर को अगर क्लॉकवाइज पुश करोगे तो इट विल कम इन द लेटरल पोर्शन. सो पोस्टीरियर कॉर्ड एज वेल एज द लेटरल कॉर्ड आर द लेटरल रिलेशंस इन द फर्स्ट पार्ट. ठीक है, हो गया. नेक्स्ट इन द थर्ड पार्ट, इफ यू ब्रेक दिस कॉर्ड्स you will find out the relations. Like medial cord का branches है, one is and those which are right between the axillary artery and the axillary vein. One is the medial cutaneous nerve of forearm, and another is the ulnar nerve. If you have to differentiate between the ulnar nerve and median cutaneous nerve of forearm, generally during dissection the teachers teach it that is the ulnar nerve is present a bit deeper. So if you मतलब थोड़ा सा forceps से if you find it out, the ulnar nerve would be present deeper, and both of these arteries are actually present between the axillary vein and an axillary artery. So it's a very important landmark. And this the one present even medial to this axillary vein is the medial cutaneous nerve of arm. हाँ, नर्व की जगह आर्टरी बोल दिया, आई गेस. नर्व. नेक्स्ट, अगर तुम पोस्टीरियर कॉर्ड को ब्रेक करोगे इट विल गिव राइट टू एक्सिलरी नर्व एंड रेडियल नर्व. सो एक्सिलरी नर्व एंड रेडियल नर्व इज प्रेजेंट posteriorly, and laterally क्या present होगा, one is that is the lateral cord का division, that is musculocutaneous nerve. So we are done with the relations. अभी the first part, second part, third part. Make a table with the anterior relations, posterior relations, medial relations and lateral relations, और खुद से फिल करो, याद करके, आग बंद करके फिल करो, मतलब बिना देखे. ठीक है, now you would be able to do. You have to always imagine the relations. ठीक है. So axillary artery more or less it's done with the course, origin, termination mention करना पड़ेगा, branches को लिख के मेंशन करना पड़ेगा, एज वेल एज रिलेशंस आर डन, डायग्राम ड्रॉ करना है. ठीक है. नेक्स्ट विल मूव ऑन टू द स्कैपुलर एनास्टोमोसिस. ठीक है, थोड़ा सा इसको नीचे करते थे क्या, नहीं छोड़ो. स्कैपुलर एनास्टोमोसिस. So let's separate it out. This is the third part of subclavian artery, and this is the first part of the subclavian artery, and this is the third part of axillary artery. ठीक है. So it gives one branch in the generally whenever in the head and neck chapter we'll learn about the branches of the subclavian artery. So वहाँ पे first part of subclavian artery का एक branch है, and that is called as the thyrocervical trunk. मतलब it's trunk. So it further gives out 3 branches. This thyrocervical trunk gives out 2 branches. One branch is the suprascapular artery, and another one is the transverse cervical artery. ट्रांसवर्स सर्वाइकल आर्टरी का एक सुपरफिशियल ब्रांच है and another is the D branch. So this is the D branch of the transverse cervical artery, which anastomosis with the subscapular artery. A subscapular artery जो third part of axillary artery से rise करता है, it gives out another one, that is the circumflex scapular branch, right? So this circumflex scapular branch and this suprascapular branch anastomosis in the body of the scapula itself. Apart from that, this deep branch of the transverse cervical artery also gives out branches to the scapula. Acromion process के round में भी there is one anastomosis. One anastomosis comes from the acromial branch of the thoracoacromial artery. Another branch comes from this posterior circumflex branch, posterior circumflex femoral branch. Okay, and the third one is coming from this suprascapular artery. So there are two main anastomosis, one present around the scapula and another present around the acromion process. तो कभी भी अगर ऐसा होता है that if there is clinical coordination, मतलब if there is injury anywhere between the first part of subclavian artery and third part of axillary artery, then the anastomotic channel that is present, it will help in providing the circulation towards the upper limb. So remember this. Next we'll move on to the brachial artery. Let's move on with the course. So course, तो अभी तो origin you also only can say tell with the diagram, that is the lower border of the, yes, there is major muscle. उसके बाद it moves in the arm from the medial to the front. You can understand, like in the cubital fossa, it is one of the contents of the cubital fossa, so it becomes one of the contents of the cubital fossa. And also whenever it is passing from in the arm, the medial nerve that is present, it crosses from the lateral to the medial side. We can also add it before the contents of the cubital fossa. So it becomes a content of the cubital fossa. The termination you can see very well. This is the head, the neck of the radius. So it is at the neck of the radius, it is terminating into its branches, that is the radial branch, radial artery and the ulnar artery. ठीक है. So that is for the course. Next अगर हम लोग branches के बारे में बात करेंगे, I am writing the branches in the diagram itself. So the main and the most important branch is the profunda brachii artery. ठीक है. And we have one nutrient artery as well, nutrient artery of humerus. Next we have two branches that is involved in the anastomosis around the elbow. One is the inferior ulnar collateral artery, another is the superior ulnar collateral artery. ठीक है. And we have also various muscular branches that is present, which will definitely supply the branches present in the arm, muscles present in the arm, and the terminating branches are the radial and the ulnar artery. ठीक है, तो ब्रांचेस आर डन. नेक्स्ट वी विल मूव ऑन टू द रिलेशंस. रिलेशंस के लिए ऑलवेज इमेजिन, ठीक है, मतलब कोर्स को इमेजिन करना है ऑलवेज फॉर द रिलेशंस. तो अगर हम लोग एंटीरियर रिलेशंस के बारे में बात करेंगे, इमेजिन कि एंटीरियरली क्या क्या प्रेजेंट है. And if you think about, you will mainly find it in three parts. Like upper part में you will find a medial cutaneous nerve of the forearm. और मिडिल पार्ट में मैंने जैसे बोला कि मीडियल नर्व मूव्स फ्रॉम द लेटरल टू द मीडियल साइड. सो एंटीरियर में भी लाइक करता होगा ना मीडियल नर्व. मीडियल नर्व इन फैक्ट मीडियल nerve will be present in all the relations. मतलब anterior भी present होगा, medially भी present होगा, and even to the lateral. Posteriorly नहीं होगा definitely. And so another one is when it lies in the cubital fossa, it is actually overlapped by the bicipital aponeurosis. So bicipital aponeurosis is another anterior relation. Next is the posterior. अगर posterior relations के बारे में बात करेंगे, if you imagine it lies on the coracobrachialis and the brachialis muscle, तो posteriorly coracobrachialis and brachialis. And you know what, dissection classes जितना attend करोगे ना, this will aid in your memory. Anterior, posterior, फिर medially क्या लाई करता होगा. Medially again we have the median nerve, and also the ulnar nerve होता है, तो it generally lies medially only, so ulnar nerve. And then we have the vein जो है, that is the brachial vein, it also lies medially. After that we would not brachial vein, basilic vein, sorry, brachial मतलब axillary artery axillary vein होता है, but brachial artery brachial vein नहीं, ठीक है. So basilic vein and laterally, that one that will be present would be biceps. ठीक है, तो रिलेशंस को कोर्स इमेजिन करके लिखना है. थोड़ा मोटा एक दो मेजर रिलेशंस लिखना इट्स फाइन. सब रिलेशंस का पॉइंट याद नहीं रहता है, एंड इट्स इम्पॉसिबल टू लर्न ऑल्सो. ओके, प्रोफंडा ब्रेकाई आर्टरी के बारे में वी विल टॉक अबाउट इट, बट लेट्स फर्स्ट टॉक अबाउट द एल्बो एनास्टोमोसिस. बिफोर दैट कि क्या क्या हमने इसमें बात की. कोर्स में ऑरिजिन, टर्मिनेशन, ब्रांचेस, रिलेशंस एंड थोड़ा सा क्लिनिकल वी हैव वन इज द ब्रेकियल आर्टेरियल पल्स. कि व्हेन I'm pretty sure कि फिजियोलॉजी का प्रैक्टिकल जब होगा, you will find that you are feeling the tendon, biceps tendon, and medial to it you will find the brachial arterial pulse. You can find it right now also. And second is Volkmann ischemic fracture. Volkmann's ischemic contracture. इसमें there is supracondylar fracture और generally brachial artery का इंजरी भी होता है, ठीक है. So remember this clinical points. Next, elbow anastomosis. Elbow anastomosis हम लोग कुछ पोर्शंस में डिटेल्स में बात करेंगे कि कहाँ पे एग्जैक्टली किसका एनास्टोमोसिस है. फर्स्ट इज इन द फ्रंट. First is we have two condyles of the humerus. One is the medial epicondyle, another is the lateral epicondyle. So medial epicondyle का दो पोर्शन है, one is the front and in the back. So if we talk about in the front of the medial epicondyle, this is the inferior ulnar collateral branch. So it will end up anastomosing with this one, that is the anterior ulnar recurrent artery. ठीक है. So 1 and 2 would be the anastomosis present at the front. In the back क्या होगा? We have superior ulnar collateral artery. Of course, it will end up anastomosing with the posterior ulnar recurrent artery. and fourth. End up anastomizing in the back side of the medial epicondyle. If we talk about the lateral epicondyle, again it will have the front and the back side. If we talk about the front, हम लोग का profunda brachii artery का दो terminal branches है. One is the anterior descending and the posterior descending. We will again talk about it when we talk about in details about the profunda brachii artery. So this in the front we would have the anterior descending branch, which would anastomose with this radial recurrent branch. So this is 5 and 6. And this 5, that is the anterior descending branch को और एक नाम देता है, that is the radial collateral branch. Okay, and the back side we would have two arteries. One is this one, that is the posterior descending branch, which we can say as the sixth one, and this artery, that is the interosseous recurrent artery. This interosseous this is the common interosseous artery. It divides into the anterior and the posterior interosseous artery. The posterior interosseous artery gives a branch, that is the interosseous recurrent artery. So it anastomoses with the 7th. This will be 7th and 8th. The 7th one, that is the posterior descending artery, is also called as the middle collateral artery. Okay, and also we would have above the olecranon process. We would have anastomosis between the 7th, that is the middle collateral artery, and the transverse branch of posterior division of this inferior ulnar collateral artery of 1. मतलब inferior ulnar collateral artery का posterior division के branch है, that is the transverse branch, which ends up anastomosing with the middle collateral artery. It is present above the olecranon process. So this is the major anastomosis present around the elbow joint. नेक्स्ट अगर हम लोग बात करेंगे अबाउट प्रोफंडा ब्रेकाई आर्टरी, ओरिजिन क्या है? ओरिजिन इज डेफिनेटली फ्रॉम द ब्रेकियल आर्टरी. The origin is from the brachial artery just below the teres major muscle, and it is also it is the most important branch of the brachial artery. So after that it will enter into the lower triangular intermuscular space. Along with the radial nerve into the spiral groove. हम लोग के ह्यूमरस के पोस्टीरियर में पोर्शन में देर इज़ अ ग्रूव कॉल्ड एज अ स्पाइरल ग्रूव, जहाँ पे एक्चुअली रेडियल नर्व इज प्रेजेंट एंड ऑल्सो द प्रोफंडा ब्रेकाई आर्टरी. सो इफ़ यू टेल यहाँ पे वी वुड हैव द रेडियल आर्टरी, रेडियल नर्व अकम्पनिंग इट. the profunda brachii artery. So after that it will emerge out and will terminate into the two branches, that is the anterior descending branch and the posterior descending branch. As I said, that anterior descending branch is also called as the radial collateral artery, and the posterior descending branch is called as the middle collateral artery. Yes, so the course of the profunda brachii artery is done. If we talk about the branches of the profunda brachii artery, we can say we would have one deltoid branch. Deltoid branch is basically moves up and basically supplies the deltoid muscle. Also it gives some muscular branches, and also we have the nutrient artery of the humerus. In humerus there are two nutrient artery. One is of the brachial artery, another of the profunda brachii artery, and also we have the terminating branches. One is the anterior descending branch, which is the radial collateral artery, and the posterior descending branch, which is the middle collateral artery. That's it. So we have done the profunda brachii artery relation, the course as well as the branches. Relations are not that important, it's not majorly asked. Next one is the ulnar artery. Ulnar artery, first let's start with the course. Origin is at the neck of the radius. Definitely it's a continuation of the brachial artery. So it will move towards the medial side of the forearm. That's pretty obvious. So as it is moving towards the medial side, in the upper 1/3 of its course it is oblique, and in the lower 2/3 it is a vertical course. As it is moving downwards, it will enter into the palm. After passing superficial to the flexor retinaculum, what exactly happens is ulnar artery and the ulnar nerve, it passes in a separate compartment under the volar-carpal ligament. That the canal is called as the Guyon's canal. So it is superficial to the flexor retinaculum only. So it will terminate by joining with the superficial branch of the radial artery and forming the superficial palmar arch. That's it for the course. Next we will have the relations. So relations भी imagine करना है. Imagine करो कि किधर किधर से the branches are moving. ठीक है. So first anteriorly हम लोगों का जो 5 superficial muscles of the forearm है, all of these 5 superficial muscles cover this artery. So we would have the pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, as well as the flexor carpi ulnaris. And posteriorly only the deep muscle is present. Deep muscle में हम लोगों का 2 है, that is the flexor digitorum profundus and flexor pollicis longus. तो flexor pollicis longus towards the thumb जाता है. So and we have it ulnar nerve medially. So definitely it flexor digitorum profundus will be present posteriorly. And also जो origin है ulnar artery का, it is present on top of brachialis. ठीक है. Medially we would definitely have the ulnar artery, ulnar nerve, and the nerve होगा medially, as well as the flexor carpi ulnaris. And laterally we would have the flexor digitorum superficialis. ठीक है. Next we'll talk about the branches. Branches we would have the anterior and the posterior ulnar collateral artery, Next we would also have this common interosseous artery, and we would have this anterior and posterior palmar carpal branch, which actually ends up forming the anterior and posterior carpal branch, which forms the anterior and the posterior carpal arches together with the radial artery, and the terminating branch is a superficial branch. Also, it contributes a deep branch towards the which is quite small, towards the formation of the deep palmar arch. Okay, so that is for the relations. Next, अगर हम लोग बात करेंगे about anterior interosseous artery and the posterior interosseous artery in short. This anterior interosseous artery is actually a branch of the common interosseous artery. So from the common interosseous artery, this anterior interosseous artery arises, and it is, and I'm just using short form, it is present in front of the interosseous membrane. ठीक है, so जो मैंने ये डायग्राम ड्रॉ किया है, दिस वाइट थिंग, आई एम कॉलिंग इट एज अ इंटरॉशियस मेम्ब्रेन. ठीक है, आफ्टर दैट some point it will pierce this interosseous membrane and end up anastomosing with the posterior interosseous artery. So the anterior interosseous artery present in front of the interosseous membrane, it will pierce it and anastomose with the posterior interosseous artery. But the branch or the course doesn't end here. It moves on. It enters into dorsum of the hand under the extensor retinaculum, and from there, and it enters into the dorsum of the hand. So there it is the termination of the anterior interosseous artery. Next we have the posterior interosseous artery. If we talk about the posterior interosseous artery, it enters into the back of the forearm. It is present behind the interosseous membrane. So it enters through that after passing in between the oblique cord. So there is one cord, that is the oblique cord. So after passing between this oblique cord and the proximal border, matlab this border of the interosseous membrane, and there is a cord present above, that is the oblique cord. Between the oblique cord and proximal border of the interosseous membrane, this crosses and moves into the posterior portion of the forearm. So it passes between the oblique cord and proximal border of arm, for proximal border of interosseous membrane. After that, it present in the behind or in the posterior compartment of the forearm. And after that, definitely the anterior interosseous nerve comes and it ends up anastomosing with the anterior interosseous artery. Okay, so that's it for the course. Next we'll move on with the radial artery. Radial artery का course भी more or less it's similar. Like the origin is at the neck of the radius, definitely. After that, for the major part of the course, it is present along the lateral border of arm, and it is just present on the cover of the brachialis muscle. Take him. After that, it lies on the anterior surface of radius Throughout its course, it is just covered by brachialis muscles, but in the anterior surface of the radius, it is only covered by skin and superficial fascia. So after it is only covered by the skin and superficial fascia, it comes and lies into the anatomical snub box. And after entering the anatomical snub box, it lies in the dorsum of hand. So after from the dorsum of the hand, it enters into the palm by piercing between the first and the second interosseous muscles of the hand. मतलब it enters into the palm between the first and the second digits, and in the first dorsal interosseous muscle का दो head है, right? In dorsal interosseous muscle का दो head है, so in the first dorsal interosseous muscle, it passes between the two heads of that first dorsal interosseous muscle and enters into the palm. By passing between two heads of the first dorsal interosseous muscle. ठीक है. After it has entered, it actually gives two divisions. One is the arteria radialis indicis and another one is the arteria principalis. And after that, what exactly happens? It the superficial branch, it joins with the superficial branch of the ulnar artery to form the superficial palmar arch. And the deeper branch जो present होता है, it joins with the ulnar artery also to form the deep palmar arch. This is how the termination occurs. Next, we will talk about the relations. Course is done, origin, termination. Next, we will talk about the relations. For relations, imagine the course. Okay? So anteriorly, in the course only I have mentioned that only covered by the brachioradialis and sorry, not brachialis, it will be brachioradialis. Okay. Brachioradialis muscle, and further it will be overlapped by just by the skin and the deep fascia. Okay. So anteriorly brachioradialis, and further we would have the skin and fascia. In deep portion we will have the supinator muscle as well as we would have the pronator teres muscle. Just remember one or two relations and you are good to go. So relations again. Next we would have the branches. For branches, let's again move on to the diagram. Diagram where we would have the radial collateral branch, radial recurrent branch. Collateral branch is the anterior descending branch of the profunda brachiae artery. Radial recurrent branch, this is. Also we would have the palmar branch, palmar, carpal branch, and also we would further have the arteria radialis indicis and arteria principalis, and also we would have various muscular branches which will supply the muscles of the forearm. Okay, so that's it for the end of the radial artery. Next we would have the last, superficial and the deep palmar arch. Let's discuss it. Superficial palmar arch, it will be formed by, one is the अच्छा थोड़ा सा डायग्राम क्लीन रखते हैं तो नीचे लिखते हैं. it will be formed one by the superficial branch of the ulnar artery, superficial branch of ulnar artery. और second जो होगा, it can be any one of the branches of the radial artery. Like it's not necessary that superficial branch of the radial artery only has to combine. ठीक है, so it can be any of 3 branches जो मैं अब बोलने वाली हूँ. One is the superficial radial branch, another is the arteria radialis indicis and arteria principalis. ठीक है, so joining these two we would have the formation of a radial artery. So you can very well notice that this is the superficial branch of the radial artery and this is the superficial branch of the ulnar artery. यहाँ पे मैंने ये दो join करके ही we have formed the superficial ulnar branch, superficial palmar branch. So if you notice, that is 1 2 3, there are 3 common digital arteries. Common digital artery का मतलब क्या होता है? Common digital artery एंड प्रॉपर डिजिटल आर्टरी का मतलब क्या होता है? कॉमन डिजिटल आर्टरी मतलब एक कॉमन सा ब्रांच होता है, वो फार्दर 2 ब्रांच में डिवाइड होकर डिजिट्स में जाता है, दैट इज़ अ कॉमन डिजिटल आर्टरी. बट इफ इट इज़ अ सिंगल ब्रांच गोइंग टू अ डिजिट, दैट इज़ अ प्रॉपर डिजिटल आर्टरी, दैट इज इट गिव्स 1 प्रॉपर डिजिटल आर्टरी एंड 3 कॉमन डिजिटल आर्टरीज. ठीक है, और एक ब्रांच देता है, दैट इज़ द क्यूटेनियस ब्रांच टू द पाम. So let's write about the branches. 3 common digital branch, 1 proper digital branch and cutaneous branch of palm. ठीक है, नेक्स्ट हम लोग डीप पामर आर्टरी के बारे में बात करते हैं. ठीक है, दिस इज द अल्नर आर्टरी, सुपरफिशियल ब्रांच, this breaks down into the digital arteries. This is the radial artery. This is the superficial branch of the radial artery. This is the deep branch of the radial artery, which would give 2 ones. One is the arteria principalis. Pollicis का मतलब thumb होता है, so that is it's going towards the thumb, principalis. और arteria radialis indicis मतलब it's going to the index finger. So this is arteria radialis indicis. And what are these 3 arteries? These are the palmar metacarpal arteries. Metacarpal के portion में है, right? Metacarpal, carpal, metacarpal, phalanges. So it's in the metacarpal region. So palmar metacarpal arteries. ठीक है. Next, if we talk about the deep palmar arch. So it is formed by deep branch of both the ulnar and the radial artery. And here अगर क्वेश्चन आता है कि डीप पामर आर्च के बारे में लिखो, तो यू कैन ऑल्सो राइट अ बिट अबाउट द कोर्स ऑफ द रेडियल आर्टरी, कि कैसे वो एनाटॉमिकल सब बॉक्स में आके इट पासिस इन बिटवीन द 2 heads of the first deep interosseous muscle, and then it enters into the dorsal interosseous muscle, and then it enters into the palm, and then it gives arteria radialis indicis and arteria principalis. After that it joins with the deep branch of the ulnar artery to form the deep palmar branch. ठीक है, so this is the formed by the deep branch of the ulnar and radial artery. So if we talk about the branches that are present here, one branch is the palmar metacarpal arteries, and this palmar metacarpal arteries are 3 in number, and it joins the common digital arteries, है ना? I just drew the diagram. Here I have seen that the palmar metacarpal arteries are seen joining the common digital artery. Next we would have perforating arteries. Perforating arteries are also 3 in number, and these pass through the second, third and fourth interosseous spaces and join basically nothing else but the dorsal metacarpal arteries. And last is the recurrent branches. Recurrent branches कुछ भी नहीं, it ends up joining the palmar arch. So it ends up joining the palmar carpal arch. तो दैट्स इट. हम लोगों ने मेजरली सारे आर्टरीज डिस्कस कर लिए. जस्ट रिकैप इट फास्ट कि एक्सिलरी आर्टरी का कोर्स क्या है, रिलेशंस क्या है, एज वेल एज द ब्रांचेस. नेक्स्ट वी हैव द ब्रेकियल आर्टरी. ब्रेकियल आर्टरी का कोर्स, रिलेशंस, ब्रांचेस पूरा ख़त्म हो गया. स्कैपुलर एनास्टोमोसिस, एल्बो एनास्टोमोसिस हो गया. अल्नर आर्टरी का इंटरॉशियस आर्टरी का भी हो गया. रेडियल आर्टरी ऑल्सो डन, एंड द सुपरफिशियल एंड द डीप पामर आर्चेस. सो थैंक यू. अगर वीडियो अच्छा लगे तो डेफिनेटली लाइक, शेयर एंड सब्सक्राइब तो ज़रूर करना है, एंड स्टे ट्यून्ड फॉर फर्दर अपडेट्स.